Hello all, welcome to this video on vitamin D and immunity. Nowadays we could see lot of videos and articles related to this vitamin D and immunity. And also we could find lot of research works going on this topic, especially during this pandemic, COVID pandemic time. So I was just looking into few of the evidences so that I could present you in this video so you'll be better understanding how vitamin D is related to immunity. So before knowing that, it would be better if you know how vitamin D is produced in our body. To say it in a simple way, if our skin is exposed to sunlight, the UV rays is absorbed through the dermis layer of our skin, and it is where the vitamin D is produced. But the vitamin D produced in the dermis layer is in inactive form. This inactive form of vitamin D is transported to liver and kidney, where it is converted to active form of vitamin D. That's called 1,25 dihydroxy vitamin D3. So this again enters into our bloodstream and it performs its various functions. One of the well-known functions of vitamin D is calcium absorption. So that it helps the calcium absorption through small intestine, and then it helps our bone density, maintaining the bone density, and calcium phosphorus homeostasis. So all these functions are done by vitamin D. So apart from this, one more function of vitamin D is maintaining our immunity. So this is what we are going to see in this video. So before knowing that, we should know what happens to our lungs when it is getting infected. See, when the lungs is getting infected with a bacteria or a virus, what happens? The air sacs called the alveoli in the lungs get inflamed. That is, it is accumulated with fluids. This fluid accumulation is happening because of pro-inflammatory cytokines. These pro-inflammatory cytokines actually produce more of fluid accumulation inside the lungs. So that is why the patient cannot breathe, or the oxygen and carbon dioxide exchange is not happening when the lung is getting infected. That is because of this fluid accumulation. So this is called ARDS, acute respiratory distress syndrome. This is what is happening even in pneumonia, in COVID-19. So this is the condition actually. So now we can go into the studies, the research studies, and we could see what the researchers say about the role of vitamin D, what vitamin D does with these cytokines. So this study says vitamin D can induce cathelicidin and deficiency that can lower viral replications and thereby reducing pro-inflammatory cytokine production. When there is more and more viral replication only, the pro-inflammatory cytokine production also increases, and it increases the fluid accumulation. Our lungs have this vitamin D receptors. So these receptors helps to attach with this vitamin D and helps in reducing the pro-inflammatory cytokine production. So thereby reducing the inflammation. This study also says that the COVID-19 outbreak occurred in winter, a time of low sunlight, hence more vitamin D deficiency levels were there in people. So this is one of the coincidence actually. So we could take it as a coincidence and not a confirmed point. They also say the mortality rate in COVID increases with age with chronic disease comorbidity, both of which are associated with vitamin D deficiency. I've given the link of this study in the description part. If you are interested, you can just click that link and go through the entire study and see what exactly they say. This study is done now recently. If you could see a century ago, that is in 1849 itself, a British physician, Williams, he has done a study using cod-liver oil in tuberculosis patients, and he has also cured almost 70 to 80% of the people who he has taken for the study with the supplementation of this cod-liver oil. See, because cod-liver oil has rich source of vitamin D in it. So that's what that study also says. I have given that link also in the description. You can just go through that the full study if you're interested. So if you see in India, more than 70% of our population are vitamin D deficient. So we can see the sources where we can get vitamin D. Abundantly where we can get is through sunlight only. In animal sources, if you see, we can get it in fish, milk, cod liver oil, etc. But for vegetarians, it's very difficult to get vitamin D from the food sources. So where we can get more is through sunlight only. And that is also an easier way to get the vitamin D. Also, it would be great that government take some steps in fortifying our staple foods like wheat, ghee, butter, milk, all these things with vitamin D, so that we could at least to some extent reduce the vitamin D deficit rate in the population. Recommended daily allowance of vitamin D. It is the RDA recommendation is 600 international units for younger adults, that is adults below 70 years of age, and 800 international units above 70 years of age. The normal vitamin D level in our serum should be 30 to 70 nanogram per ml. If it is less than 20, then it is considered as deficit. So you can expose yourself to daily sunlight in the morning time, maybe in between 7 and 10, half an hour to 45 minutes. And you can have at least 500 ml of milk and milk products like milk curd and all, so that vegetarians can get some amount of vitamin D. And people who eat non-veg foods can have fish at least weekly thrice. Maybe they can even go for some cod liver oil supplementation. So in this COVID time, it's better to do a test and see how your vitamin D level is in your body. And if it is deficit, then better consult a physician first and take the appropriate doses as the doctor says. Don't take it on your own. It is very dangerous. So do a test, keep your vitamin D levels on the safer side, improve your immunity, be safe. Thank you.